Hey everyone, it's Nurse Sarah, and in this video I'm going to be going over premature ventricular contractions. So let's get started. PVCs are early contractions that originate in the ventricles. So we're talking about those bottom chambers of the heart, and it's usually due to ventricular irritability. So those ventricles are not very happy, and these early contractions can happen suddenly and interrupt the normal electrical conduction process. And here on your screen you can see what a typical PVC may look like when it presents within an underlying rhythm. So our underlying rhythm is normal sinus rhythm. So we have our little sinus beats going, and then all of a sudden on our fourth beat we have that PVC. And notice after the PVC we have this little pause known as a compensatory pause. That's just allowing the heart to reset itself, and then our SA node picks things back up again, and then sinus rhythm resumes. So what are some key characteristics that you want to remember about PVCs? Well, whenever you're taking a peek at your underlying rhythm on your rhythm strip, you're going to notice all of a sudden this premature contraction that occurs, and it's going to be wide and bizarre. So your QRS complex is going to be greater than 0.12 seconds. After that premature contraction, you're going to see this compensatory pause that we talked about earlier, and again, that's just the heart resetting itself, preparing for that next beat. Also, because all of a sudden we have this premature contraction, it's going to throw off the regularity of our rhythm. So our rhythm is going to be irregular, but the underlying rhythm that's outside of that PVC is typically regular. And you're not going to see a P wave. He is missing. And because our P wave is missing, you're not going to be able to measure the PR interval within that premature ventricular contraction. Your QT interval, you can't really measure it accurately because we have this wide, bizarre QRS complex. And sometimes, not all the time, but sometimes you can see an inverted T wave after that PVC. Now, there are different types of PVCs. One type is known as Bigeminy. So if you hear someone say, my patient had some Bigeminy, this is what they're talking about. They're talking about that their patient had a normal beat and then a PVC, and a normal beat and a PVC. So the PVC is occurring every 2 beats. Or they may say, my patient's having Trigeminy. What that means is they're having a beat, beat, PVC, beat, beat, PVC. You can almost sing that as a song. So the PVC is occurring every 3rd beat. Now, PVCs can look a little bit different. Sometimes they can be all uniform where the PVC looks the same, but sometimes they can look a little different. They'd be multiform. So PVCs are different, as you can see here in this illustration. And then PVCs can sometimes run in couplets where you have 2 together. So you have here in this illustration, what you can see, we have a beat, beat, and then we have 2 PVCs together. Now, you always want to be familiar with the type of PVCs your patient is having, because although PVCs can be a benign thing, they really don't cause problems, certain characteristics of certain types of PVCs could mean that your patient has an underlying heart condition and it needs further investigation. So some of those characteristics that you want to be aware of are the following, and to help you remember those characteristics, remember this mnemonic I created called PVCs. First characteristic is that the premature beat occurs with the T wave. This is known as the R to T phenomenon. And this can result in an increased risk of the patient experiencing VTAC or VFib, especially in patients with heart disease. Another thing is variability in appearance. So the patient's experiencing multiform PVCs where they don't all look the same. That tells us that that PVC is coming from different sites. And then if the patient is having consecutive PVCs, meaning that they're occurring in pairs or runs, that is not a good thing. So when a patient has 3 or more PVCs in a row, we call that actually a run of VTAC. And then lastly, the sequence of beats. So Bigeminy or Trigeminy definitely needs to be further evaluated as well. So what can cause PVCs? Well, we know we're dealing with premature ventricular contractions. So remember this other mnemonic I created called premature. Prolapsed mitral valve can cause PVCs. Risks such as caffeine intake, stress, nicotine, electrolyte imbalances, low potassium and magnesium, myocardial irritability like a heart trauma or disease, anemia, thyroid problems like hyperthyroidism, underlying heart conditions like a myocardial infarction, coronary artery disease, heart failure, rhythm disorders such as atrial fibrillation and bundle branch blocks, and then lastly, elevated blood pressure. Now let's talk about the treatment for PVCs, because as a nurse, we want to be familiar with the possible treatments that may be ordered for a patient who is experiencing these types of premature ventricular contractions. So random PVCs typically don't cause signs and symptoms. A lot of patients aren't even aware that they're having them. But when they become frequent, that's when they become a problem. Patients typically start to have signs and symptoms of dizziness, syncope, they may feel palpitations, and their blood pressure may drop because, especially if they're frequent, it could be lowering the cardiac output. So as I pointed out earlier, these PVCs could lead to dangerous dysrhythmias like VTach and VFib. Therefore, treatment for patients with symptomatic frequent PVCs, especially in those with underlying heart disease, could involve addressing that underlying heart condition and using medications such as antiarrhythmics like flecainide, beta blockers, or calcium channel blockers, and this will help reduce the frequency of those PVCs. And if medications are ineffective, a cardiac ablation may be considered to eliminate the source of the PVCs. Okay, so that wraps up this review on PVCs. And if you'd like to watch more videos in this ECG series, you can access the link in the description below.